Professor Tasanee, good afternoon, and thank you for this time that you've provided for this interview regarding gout and hyperuricemia.
Yes.
We'd like to know in Thailand, how is the diagnosis made, and how common is synovial aspiration used by in your practice in the rheumatology clinic?
For the diagnosis of gout in Thailand, we actually, as I'm rheumatologist, so normally when I take the history and then see what the most likely joint involved, so we can just give the detail and the diagnosis of gout, not necessarily to do the joint aspiration. But sometimes in some controversial joint, like some clinical clue that not exactly the gout, maybe we need to do the arthrosynthesis. But for the some case that the gout was diagnosed by not non-rheumatologists, maybe they just misdiagnosis because of the see some high of uric acid level, and then they jump to get that is the gout. That is not true. Sometimes the uric acid fluctuate depend on some stress, some situation, some medicine. Okay, so the second question is about the synovial fluid analysis, right? For me, the diagnosis is by clinical diagnosis. So the need for the synovial fluid analysis, it depends on that. We are thinking about the different things in this joint. Maybe like we will consider about the septic joint or some kind of the other inflammatory that we have to differentiate. That's why I do the arthrosynthesis. Or the second reason that I do the synovial fluid analysis, just for the relief of the patient to remove the fluid. Okay.